Hi, my name is Sabrina. We are just going to be talking about some of the objectives that I've met in this leadership class. So the first objective is utilize previous knowledge of the sciences and the experiences that we have. So I had a peer leadership 309 clinical. So, I went in, I helped assess patients with the students, I helped with documentation, I helped them with their prep. There's actually an instance that one of the students almost passed out, so I helped her with that. And in the ANA Code of Ethics, it states that you want to respect your colleagues. I think it's actually like 1.5, the ANA Code of Ethics. So provision 1.5, excuse me. So it says that you really want to respect your colleagues and provide that safe, competent care with them. So I think I did that by helping them, figure out, their assessments, their documentation, and everything like that. And then I also had a blood drive at a church where I went in, took people's blood pressures, taught them about blood pressure. So I had to know what a blood pressure was, how to take a blood pressure, what the normal level of blood pressure is for different age groups. We had some pediatric patient or people there as well. So I had to know all that information going into it. So again, really meets the ANA Code of Ethics, working with each other. I had other students with me, so working well with each other and individuals and promoting that health and safety for the patients. So objective 2, apply basic principles of management to meet the changing of an ever-changing healthcare environment. So I had an interprofessional experience at New Eastwood Rehab Center. So everybody sat down, the physical therapy, the respiratory, case management was there, the nurses of the head floor, and then the main nurse that kind of ran the whole facility was there as well. And we all sat down and, we learned about managerial styles in class, and she had a very democratic leadership style. She talked about, what can we do as a team? She didn't really say anything about, you need to do this or I need you to do this, and I really respected that. And, I think that managerial style went well with that environment. So I also had the stand down for veterans, the homeless veterans. So I helped give out socks to the homeless veterans, and there's two people there, Cherokee and Kim, and they had no managerial style. They were leaders, and it was amazing to see because they really encouraged themselves, each other. They encouraged me to, it was amazing. They encouraged the veterans that had no homes. It was an amazing experience. And in our book, the Sullivan 2016, it actually talks about transformational leadership, and transformational is inspiring others, pursuing higher values, and that's really what they did. They inspired everybody there and inspired those homeless veterans as well. So for objective 3, demonstrate leadership skills through effective use of communication by representing self, the college, and nursing in a professional manner. So in that instance, again, I had the peer leadership 309 clinical. There was an instance that one of the students heard like a weird noise with the heart, so I went in and assessed, and it was actually just irregular heart rates. But the big thing with this is I went in, came out and said, make sure you communicate with your nurse, your professor, your instructor, because communication is key. It's one of the biggest things. And again, in the ANA, you want to provide, the ANA Code of Ethics says you want to provide that safe and competent care, and communication is part of that. Communicating with, the doctors, the techs, and everybody that's involved with that patient care. I also had the experience of the nurse supervisor as well. So she didn't run the floors, but she went in, see what the units needed, if they needed any Foleys, if the staffing, if they needed any nurses or any more techs, just anything that they really needed. And she did this in a we learned in class about middle level managers. So she was more a little middle level manager. So when I went in, she was talking with people from Cedar Crest, talking to them, saying, what nurses do you need? What do I need? Do you have enough supplies? And and then she relayed that information from her to the units that she had. So she really relayed that information between the different levels of management, which I think was really good. So objective 4, which was critically evaluate and disseminate current research related to the principles of leadership and the effects on the healthcare system. So I'm going to go back to Capitol Hill Day. One of our peers actually brought in a statement saying that she would like to have wound care at every AED. You know, she researched this coming into it. She researched what Stop the Bleed was. She researched everything that needed, how much it would cost, and everything. And she came in and took that leadership style and expressed her feelings of, you know, I think we need this. And, you know, she disseminated that research. And in the ANA Code of Ethics in 9.3, it talks about social justice, how one nurse has the responsibility of speaking for all nurses. So for us, it was, you know, she spoke for all of us in saying that we need those wound packs at every AED. You know, she's not only speaking for us, but for people who, you know, maybe need it if there's a bombing in an instance at any place. So she really spoke for everybody in that instance. And then I also had the nurse residency program graduation. So they had all the nurses had their 1 year of the residency program, and at the end of it, they had to perform like a research. In the emergency room, I know a couple of the emergency nurses there were talking about how the patient waits, the wait times, people were getting upset. So they really looked at the research, see what are people upset about, what makes them upset. And a lot of it was they didn't know what was going on. So they actually made a video saying why it takes quite a time for people to get seen in the ER. And it was really cool because, you know, they disseminated that research and saw like what do people need, what do we need as nurses, what do those patients need as, you know, patients. And in the ANA Code of Ethics, again, it says, you know, research and scholarly inquiry is needed to be an ethical nurse to help gain that knowledge and provide safe and competent care. So objective 5, function as a competent patient advocate, nurse advocate, and change agent. So in the advanced nurse practice, I was in the ER, and there was a code, and one of the doctors was trying to get blood from the femoral vein, and she couldn't get any blood. She kept, you know, sticking the patient in and out, you know, and then this nurse actually said, well, why don't we get her labs from it too? We can get blood, we can get her ABGs, we can get everything from it. And the doctor kind of just ignored her and said, no, I'm going to keep trying. And that, we learned in our books and from the Sullivan 2016 that, you know, advocating for the patient is, you know, standing up for that patient when they can't. That patient was coding, and, you know, they couldn't stand up for that. They couldn't say, hey, stop doing that. So that nurse really advocated for that patient. And then in the Dying to Discuss, one of the Dying to Discuss at Cedar Crest, there was a mother who was coming in and talking about how she found out her son had type 1 diabetes. And she was there as a change agent. She came in and explained that she wanted glucose testing at every pediatric appointment because DKA and, you know, type 1 diabetes is so hard to find until it's last minute. And she, as a change agent, we learned in class that that's somebody that comes in, changes to better the healthcare team, to better the process. She wants to better the process so people don't have to suffer the instances of when children do go into DKA. She was advocating and being a change agent for those other people. So objective 6, which is formulate plans for continued personal leadership growth and development as an independent practitioner of nursing, contributing member of society. So in the Dying to Discusses at Cedar Crest, there was an ER nurse that came in and was explaining her job, you know, how she loved it, explaining how she went on to get her pre-hospital RN, and she really motivated me. The way she talked about her job and the way she talked about her certification, it really motivated me. And in class, we learned about different types of motivation, and I think this one was an extrinsic motivator because seeing her and seeing her rewards from that really motivates me to do better and to maybe, you know, see how I can better myself, how I can get other certifications as well. Another instance was the nurse supervisor. She was a great leader, and that really motivated me to go back to school. See what other leadership styles I can learn from that, because she was a great leader. She and manager. She really went the higher level management and the lower level management, and influenced everybody in a positive way. So objective 7, recognize the role of the nurse in policy making related to healthcare services at a local, state, national, and global levels. This was our Capitol Hill Day in Harrisburg, so we went in and talked with different people. I actually went in with somebody at Judith Schwenk's office, and we talked about the Senate Bill 25, which is that every nurse practitioner needs a physician to practically sign on. And she was telling us that it's at the House of Representatives right now. It just needs to be read, but it may take a while. But in class, we learned about Houston Action Plan for Nurses. So I really applied that to this instance. The action plan includes placing nurses in more positions that influence public policy, to stop acting like victims, network, increase your research to strengthen the evidence-based practice, and to really be a voice for everybody. And I think that's really what I saw at Harrisburg. And then PSNA also came in and talked about how they really told us that every nurse has a voice, but they really solidified that if we come together, we can really make a difference. And in the ANA Code of Ethics, I think it's 9.3, they talk about, again, social justice, being that voice for everyone, responsibility as a nursing community as a whole, to shape that safe, competent care. And then objective 8, predict and describe potential ethical dilemmas within clinical, organizational, and professional nursing practice. So the only really big ethical dilemma I had was, again, when I was at the advanced nurse practitioner. That nurse was advocating for the patient, and in class, in the book, everywhere. This program has taught me, you really want to advocate for your patients, and that's what he did. And to me, it was an ethical he did what he needed to do as an ethical nurse, but the ethical dilemma that I saw was that the doctor wasn't taking into consideration, and to me that was a big ethical issue. And then and I think that's the only ethical issue that I saw, but another instance that I was thinking of was I had Meals on Wheels. So I went with a couple and delivered some meals to different people. And some of these people, they could barely get out of bed. They could barely get out of their seats. One of them were blind. And to me, before this, I never heard of Meals on Wheels. And to me, this is such a great way for patients from the hospital to go home and see and take care of themselves, because sometimes we send them home with a no sodium diet, and they go home and they don't know what that is, or they go back to eating sodium. And I think for this, the Meals on Wheels is such a great ethical thing that it really takes care of them when they're at home. In class, we learned about total patient care models, and I think this really emphasizes that. Because, in the hospital, you're taking care of them at that moment, but this helps take care of them at home when they need it. So, thank you for listening.